Welcome back, dear uncles, aunts, brothers, sisters, and friends, to the Daily Life channel, where we explore knowledge about health, nutrition, and scientific lifestyles in a friendly, easy to understand way. While still relying on reliable medical evidence, cancer has long been considered one of the most dangerous diseases of our time. What makes it frightening is not only the severity of the illness, but also the fact that many people only discover cancer when it has already progressed to a late stage. However, many modern medical studies show that cancer rarely appears suddenly, before the disease actually develops and is diagnosed. The body often undergoes certain changes, sometimes lasting for many months. A notable study analyzed data from more than 900 cancer patients and found that many abnormal signs appeared about 6 months before the disease was officially diagnosed. This suggests that our bodies often send warning signals very early, but many people either fail to recognize them or unintentionally ignore them. In today's discussion, we will take a closer look at the warning signs of cancer that may appear up to half a year earlier, as well as symptoms that are often overlooked but deserve attention. A study of more than 60,000 people. Unexplained weight loss may be an early signal of cancer. A study published in the British Medical Journal, BMJ, followed more than 60,000 adults who experienced unexplained weight loss within 6 months. The results showed that 908 people were later diagnosed with cancer. When researchers analyzed the data more deeply, they found that before the cancer diagnosis, these individuals often experienced a series of symptoms that appeared repeatedly. What is notable is that these symptoms were not severe. In fact, many people believed they were simply common health issues. Common signs appearing in men before cancer is detected. In men, the study recorded several symptoms that appeared before diagnosis, including rapid and unexplained weight loss, persistent abdominal pain, loss of appetite, difficulty swallowing, chest pain, coughing up blood, an unusual mass in the abdomen, jaundice, anemia, lymph node disorders. These symptoms may be associated with different types of cancer, such as lung cancer, stomach cancer, esophageal cancer, liver cancer, lymphoma, colorectal cancer. Common signs in women. In women, common symptoms before cancer detection include unexplained weight loss, persistent indigestion, loss of appetite, abdominal pain or diarrhea, a mass appearing in the abdominal cavity, chest pain, anemia, jaundice, lymph node disorders, venous thrombosis. These symptoms may be linked to stomach cancer, colorectal cancer, ovarian cancer, cervical cancer, liver cancer, lymphoma. Researchers emphasize that the presence of these symptoms does not necessarily mean someone has cancer, but they may increase the risk and should be medically checked in time. Early cancer warning signals that are easy to ignore. In the early stages, cancer often does not cause severe pain or obvious symptoms. As a result, many people overlook important warning signs. Below are signals that deserve special attention. 1. Persistent or recurrent fever. Fever without a clear cause, especially persistent or repeatedly recurring fever, may be related to certain types of cancer. This occurs because as tumors grow, the body may activate immune responses to fight abnormal cells, which can trigger fever. Some cancers commonly associated with fever include blood cancers, leukemia, lymphoma, certain metastatic cancers. In particular, there is a type of fever known as tumor fever. People experiencing this type of fever often develop fever in the afternoon or evening, have mild temperature increases, see the fever naturally drop by the next morning. This pattern is commonly seen in lymphoma. 2. Persistent unexplained fatigue. Fatigue is very common in modern life. However, if rest does not improve it, there is no clear cause, the feeling of exhaustion persists, then it may indicate an underlying health issue. In many cases, prolonged fatigue may be linked to immune system decline, anemia, metabolic disorders, or the development of tumors. Some cancers such as blood cancer, colorectal cancer, and stomach cancer may cause persistent fatigue due to anemia. 3. Appearance of unusual lumps. One of the most noticeable warning signs of cancer is the appearance of abnormal lumps or hard masses in the body. Common locations where they may appear include neck, armpits, breasts, abdomen, groin. Interestingly, malignant tumors in early stages often do not cause pain, which is why many people ignore them. If a lump gradually enlarges, feels hard, does not move when touched, persists for a long time, it is important to seek medical evaluation promptly. 4. Persistent unexplained pain. Pain that persists in a specific area of the body, especially lasting more than a week and not responding to usual medication, may be a warning sign. Examples include persistent abdominal pain, possibly linked to colorectal or stomach cancer; long-lasting chest pain, possibly related to lung cancer; chronic bone pain, possibly associated with bone cancer or metastasis. Not every pain indicates cancer, but unexplained persistent pain should always be checked medically. 5. Changes in bowel habits. Unusual changes in bowel movements may signal digestive disorders, including colorectal cancer. Symptoms to watch for include more frequent bowel movements than usual, alternating diarrhea and constipation, unusually thin stools, mucus or pus in stool, blood in stool. If these symptoms persist for several weeks, medical examination is recommended. 6. Abnormal bleeding. Unusual bleeding is an important warning sign. Examples include blood in stool, may be related to hemorrhoids, intestinal polyps, or colorectal cancer; blood in urine, possibly linked to infection, kidney stones, or bladder cancer; coughing up blood, may indicate lung cancer. Women should pay special attention if they experience bleeding after menopause, bleeding after sexual intercourse, bleeding outside the menstrual cycle. These symptoms may be associated with cervical cancer or endometrial cancer. 7. Unexplained weight loss. According to the American Cancer Society, sudden weight loss is one of the most common warning signs of cancer. If within 6 to 12 months you lose more than 5% of your body weight without trying, you should consider a health check. Some cancers that often cause early weight loss include stomach cancer, esophageal cancer, pancreatic cancer, lung cancer. Weight loss occurs because tumors can alter the body's metabolism, causing the body to burn energy faster. 8. Unusual changes on the skin. The skin can also reflect internal changes in the body. Warning signs include a mole suddenly enlarging, changes in color or shape, bleeding around a mole, small new moles appearing nearby. These may be signs of malignant melanoma, a dangerous form of skin cancer. Additionally, if skin sores frequently appear, wounds heal slowly, unusual skin patches develop, medical evaluation is necessary. Important things to remember: having the symptoms mentioned above does not necessarily mean you have cancer. Many other conditions can cause similar signs. However, it is important not to ignore warning signals that persist or repeatedly appear. Early detection of cancer can significantly increase the chances of successful treatment. In many cases, if detected early, the disease can be controlled or even completely cured. The human body is like a sophisticated warning system. When something abnormal happens, it often sends signals. Therefore, listening to your body, paying attention to small changes, and having regular health checkups are the best ways to protect yourself. If you notice unusual symptoms that persist, do not hesitate to seek medical advice. Thank you, dear uncles, aunts, brothers, sisters, and friends, for taking the time to watch today's video. If you find this content helpful, please share it so more people can learn about it. And don't forget to subscribe to the Daily Life channel to continue exploring topics about health, nutrition, and scientific lifestyles in future videos.